everybody. I hope you are doing well. My name is Dr. Heather Moore, owner of Total Performance Physical Therapy. Let's talk about how to care for a torn rotator cuff. Probably the number one reason people try to go as long as they can before they go see somebody with shoulder pain is they're afraid it's a rotator cuff tear. They're afraid it leads to surgery, and everybody's heard the horror stories about rotator cuff surgery. So it's something everybody tries to avoid and ignore shoulder pain because they don't want to deal with it. They think it's going to be surgically or something that needs surgery in order to fix it. And the good news is most of the time, if you catch it early enough, it doesn't actually, even if it is torn, it doesn't need to be surgically repaired. Unfortunately, that head in the sand, ignoring it as long as we possibly can, is what leads to an actual tear that can lead to surgery. So the quicker you address that rotator cuff tear, the better you're going to be. So what is a rotator cuff tear? So the rotator cuff is located in your shoulder in the back. There's a portion of it underneath your shoulder blade, and then there's muscles on the back of your shoulder that comprise the rotator cuff. It's not one muscle, it's actually a group of muscles, and it's responsible for holding your shoulder in place while your hands move, your arms move, everything happens. So it's very important, which is why it's a common shoulder problem. A lot of times it starts with an inflammation, whether it be something called an impingement, maybe even a tendonitis. Maybe some of you have heard of those terms and been diagnosed with those things. That is what can start that process of actually that rotator cuff tearing. Or it could just be over time. We do get these micro tears in the rotator cuff. So it's important that once you learn that you have a rotator cuff tear, that you do things at home, whether that is going to therapy or just treating it on your own, to make that better. Now, if you have been diagnosed with a rotator cuff tear and you haven't seen professional medical treatment such as a physical therapist, I really highly advise you to do that. Doing this stuff on your own is the eventual goal of physical therapy, but not having that worked on, not having that shoulder, making sure that shoulder is working correctly, super important in order to avoid that complete tear. And when we talk about a complete tear, that's when surgery is required. A lot of times the incomplete tears, the small tears, the partial tears do not require surgery. But what can you do to help a rotator cuff tear? Number one thing, posture, okay? So depending on where that tear is in the rotator cuff, most of the time it's in the part called the supraspinatus, and that's part of the muscle up here that's affected by posture. But any muscle in the rotator cuff is affected by posture, and this is really going to cause that to tear, become a complete tear much sooner, or maybe it doesn't even have to become a complete tear. So, but if you sit like this, if you have this round posture, if you're staring at your phone, if you're sitting at your computer, this is what actually kind of almost saws away at that rotator cuff, causing that tear to become greater. So one of the things you want to do right away is fix your posture. Now, most people will just start jamming their shoulder blades back, thinking that's the way to correct your posture. What you want to do is roll your shoulders up, back, and drop them down. This will put your shoulders in proper position, okay? This is an overcorrection, okay? This is wrong. So you want to really just up, back, and drop them down. This is going to properly position your shoulders to give that rotator cuff room to breathe. Anytime you're like this, anytime you're like this, you're actually pinching that rotator cuff. You're causing that inflammation, which is then going to increase that likelihood that you're going to get a tear and then eventually a complete tear. So having that proper posture, really, really important. The next thing is to actually strengthen that rotator cuff. And we go to the gym and we do all these exercises. Very rarely do you actually do things just for the rotator cuff. So if you have a band at home, you can do an exercise where you hold the band here and you just rotate your shoulders out. If you don't have a band, just put your palms straight up like this, and all you're doing is just squeezing your shoulder blades together, nice and easy, okay? Again, nothing crazy. It's not something where you're going to lift 100 pounds doing this, even if you have a band, but it is going to help strengthen that rotator cuff. It is going to help strengthen the back here where you need it the most, where that rotator cuff is located. It is going to gently help strengthen that. And the final exercise you can do is you can lay on your side and you can rotate your arm up like this. Okay, that's a little bit more advanced. If you're getting pain with this, you want to make sure that you don't have pain before you lay on your side. That's a little bit of a progression that you can do to strengthen that rotator cuff. What you also can do is you can work another angle where you just sit down and you push your butt off the table. Okay, here I have a nice ledge. You can do this on a chair, you can do this on a bed, but you want to push that butt off the table. Again, that's going to reposition that shoulder, allow that shoulder to have that maximum space, so that way it's not being irritated. That rotator cuff isn't being sawed in half. It isn't being touched by a bone. It's really able to move freely and able to help that tear heal. There is lots of evidence that show that tears, especially the smaller ones, can heal, but you have to actually let it have room to breathe. And usually I say you need to really consult somebody, medical professional, in order to be able to get you on the right track to make sure you're doing everything correctly. If you or someone you know is suffering with shoulder pain and wants a free consultation with a doctor of physical therapy, all you have to do is call our office at 215-997-9898 and we'd be happy to get you in. Thanks and have a good night.